Welcome back. Our Doctor on Call is here again to answer some of your health questions. We welcome back Dr. Ryan Stanton, an emergency physician from UK Healthcare. And we're going to get straight to our questions today. We have several good ones that came in. Whitney posted this question on our website. She wants to know about brain damage. When should I be worried if my daughter bumps her head? She says she doesn't want to freak out every time it happens, but she, of course, wants to know if there's any damage done. And I'm sure this is something you guys see a lot of in the emergency room.
Well, I see it a lot in the emergency room, and I see it a lot at my house. One thing I learned quickly about being a parent is that gravity and children don't go together very well. So this is something that's very important, and as a parent myself, I understand the concern, I understand the fear when you see your child hit their head. And honestly, the damage done to children usually is less than adults just because they're not really heavy and they're closer to the ground to start with. But they can have very serious injuries. So there's some very important things we do as physicians to look into this. The picture you're seeing there is actually an example of one thing we look for, which is a hematoma right there at the top of the screen. That bump on top of the head is actually blood built up outside the skull. What we're looking for is those outside signs that indicate the brain on the inside of the skull could be damaged. A hematoma, which is that blood collection, is one of them. Other things people always talk about is the child knocked out. Have they started vomiting, that intractable vomiting that you get with increased pressure in the head? Are they acting differently? Are they stumbling around? Are they confused? Are they wanting to fall asleep? Those are the things that we look for that are very important and can indicate that your child is sick. So, what you do as a parent or as somebody, a bystander, you need to look for those things. Anything concerning in terms of the way the child is acting. Normal mental status, which means are they acting normally? Are they oriented? Are they interacting with you the way they usually do? No non-frontal hematoma. That means anywhere other than the forehead. The forehead's designed to be hit. The rest of the head is a little bit thinner. No loss of consciousness. And that's more than a few seconds. If your child, when they fall, is not responding to you, that should be a worrisome sign. And no evidence of skull fracture. That's more for us in terms of the practitioner side, but if you can see a deformity in the child's head, that's something immediately to get them there. It doesn't mean we're going to sit there and do any crazy tests, that we're going to do CT scans or anything like that. We may just watch them for 4 to 6 hours, but that may be what it takes to make sure that your child is okay. And we have some great tools to diagnose now, but we sometimes will try to stay away from some of them because of radiation, especially with CT scans, but we want to do what's best for the child.
Well, moving from some common childhood injuries to one of the common conditions as we age, arthritis. This question also on our website is about the difference between regular arthritis and rheumatoid arthritis.
That's a great question. Two different sides of the spectrum, really. What we're talking about with osteoarthritis, and I actually brought a little bit of an example here, how we're not too different in terms of when we get older, that our bones are a lot like chalk. So I want to thank my daughter for allowing me to steal her toys. She's very bored at home now with nothing to do. But when we're younger, it's just like these plastic covers. The joints have these nice little things that allow them to rub together without losing anything. As we get older, we wear that out. And Mary probably needs to be taking notes on this because as she runs a lot, she's going to end up like this. The bones then start rubbing together. And so then as they rub together, you start breaking that down, and you can actually end up where the bone is actually wearing down. So that's when we get the spurring, that's where we get the pain, that's where we get the inflammation of osteoarthritis. Osteoarthritis, the traditional aging arthritis, gets worse as you get older, and it's worse during the day as you are on your legs more. Rheumatoid arthritis, on the other hand, is actually where the body is attacking itself. Your own immune system is going after your bones, thinking that it's something that's not supposed to be there. It's actually attacking the joint. Over time, that breaks the joint that's down. And so this is a picture of somebody who's had it for a very long time, and you get those deformities of the fingers. They start to angle out just a little bit, and that's what you'll see. So this is a system or a problem that actually during the day, as you're more active, the symptoms get better. This is an important thing because you need to get treated and evaluated for it because it's something that with some medicines can be prevented in terms of some of the long-term symptoms. So rheumatoid arthritis, younger folks, your body attacking itself. Osteoarthritis is typically older folks, older than 40, and caused by wear and tear. Both of those you can be evaluated. Rheumatoid arthritis we have more tools for if caught early. The osteoarthritis, a lot of strength training and physical therapy.
Well, some great information as always, and if you would like to ask a question or see some of the answers from our previous Doctor on Call segments, just go to the Health section and on the Health tab, just click on the drop-down menu and you'll see Doctor on Call. Thank you again for being here.
You're welcome.
Well, you need to take that sidewalk chalk back to your daughter because it's a beautiful day to be outside and play. Meteorologist Mary Watson has a look at your forecast up next.